Codependency is often described in the context of drug abuse, when one person abuses the substance and relies on the other person for food, money, or shelter. However, codependency is much more than that, says Jonathan Becker, an associate professor of clinical psychiatry at Vanderbilt University in Nashville, Tennessee. Before we continue, let me tell you a fun fact. If you subscribe to this channel, the red button below will turn gray. So subscribe to this channel right now and let's get started. Codependency is any condition in which two individuals get so engaged in each other that they can no longer operate independently, according to Dr. Becker. The other person defines your mood, happiness, and identity. In a codependent relationship, there is generally one individual who is more passive and unable to make their own decisions, and a more dominating personality who derives some joy and satisfaction from managing the other person and making decisions about how they will live. Codependency is commonly referred to as relationship addiction by Mental Health America because codependent persons establish and grow dependent on toxic, emotionally damaging relationships. Codependency becomes serious when one person takes financial or emotional advantage of the other. Becker adds, what is driving this conduct? Though is usually subconscious, one person is not necessarily consciously attempting to influence the other, even if that is the result. Similarly, someone who defines himself through a relationship may not be doing it consciously. Gaining knowledge of one's own subconscious motives at work is essential for changing one's position. Enabling is defined by Mary Catherine Segota, a clinical psychologist at Counseling Resource Service in Winter Garden, Florida, as a practice used to alleviate marital stress created by one partner's troublesome habits. Enabling behavior involves bailing your spouse out of prison or financial issues, continually giving him or her another opportunity, ignoring the problem, accepting excuses, always being one attempting to repair the situation, or frequently coming to the rescue in various ways. Codependence is not officially recognized as a diagnosable mental health disorder. However, some research has shown a link between codependent characteristics and disorders recognized in the Diagnostic and Statistical Manual of Mental Disorders, the diagnostic guide used by mental health practitioners. Exploratory research published in Alcoholism Treatment Quarterly discovered a link between codependency and borderline personality disorder characteristics. Codependent personalities typically exhibit a persistent pattern of harmful behaviors that directly interfere with the individual's mental health and capacity to achieve fulfillment in a relationship. Excessive caretaking, controlling, and obsession with people and things outside ourselves as signs of codependency, says Sharon Cruz, a consultant, educator, and author of several books, including Understanding Codependency. Codependency symptoms include difficulty making decisions in a relationship, difficulty identifying your feelings, difficulty communicating in a relationship, valuing the approval of others more than valuing yourself, lacking trust in yourself and having poor self-esteem, having fears of abandonment or an obsessive need for approval, having an unhealthy dependence on relationships even at your own cost, having an exaggerated sense of responsibility for the actions of others,